contacting your legislator, identifying your congressional member, the committees they serve on, or their position on an issue or bill is not complicated. We're giving you two opportunities and websites to go to. Congress.gov. You can scan this and locate your legislator. Another one is govtrack.us. This I enjoy because it gives me quite a bit of information on the history of a bill and those that support it. This is how this site looks. This is an example of a bill, House of Representative Bill 6087, where we're advocating for nurse practitioners to be able to serve our patients when they have a workman's compensation claim as an injured federal worker. Joe Courtney was the initial sponsor for this bill. More about it, you can just go to GovTrack. And this is another way you can access it. But first, you find out who your congressional person is, but then you need to prepare for writing your letter, your visit, or calling. And it's to answer the who, what, which, and why. Who sponsors this bill? Is it sponsored in both houses? If it's sponsored in both houses, there is a strong likelihood that it will be passed this year or next year. How many have signed on as sponsors? The more sponsors, the better the opportunity for that bill to go through. Who are the stakeholders? Will they be positively or negatively affected? And if it's negative, is it there good information to support that it's not? What's the history of this bill? And why is it at the current status? A good example of this is the diabetic bill, where nurse practitioners could order shoes. We have been advocating for that since 2018. What's wrong with the bill? Why is it been down regulated? Does it need to be more stringent? Is it replacing something? Who's opposing it? Are there social implications to this? Will it favor one group more than another? Is there statistical information to support your findings? How much is this bill going to cost? This is part of the what. Are there legal implications? Will it override a state law? Is there going to be harm or cause inequity in carrying out this bill? The which political implications? Which part of the bill is a pro or con for the legislator, especially in an election year? They tread very carefully. What is the opinion of the constituents? Are the majority of the constituents in your area? Do you need to educate the community first? What pressure is the political party using for this particular bill? Why? Discuss the legislative issues and the impact they have on patient care. And you need to be very clear in that you are discussing the House bill, you talk to the House of Representative person. A Senate bill, you want to talk to your senator. And don't get your state bills and your national bills confused. Real life story. They love stories. Give them what we call an elevator speech, a 1 minute or less quick story on why this bill would be so important. You want to focus on the access, the quality, and the cost effectiveness. And data speaks volumes. If we've put together a brief, use it. And you really, when you're talking about this, you don't want to go in globally. You want to focus on your local area and your patients there and the legislators, constituents. You want your legislator to know you're representing us. This is what you have in your district. Many times the legislator will come back. One of the things they'll say, well, what about this group that will be negatively impacted? Do you have an answer? Maybe, maybe not. But if you don't, just be honest with them. Let them know. Offer to be a resource. Tell them you're welcome to contact me if something comes up that's in my area, and I'll be glad to discuss with you. And always thank them for their time. Even if they are negative and opposing, always thank them. Send a follow-up email. So there's different ways to communicate. You can do the face-to-face, live, or virtual live when they're in town. Also, a couple of legislators from Tennessee have what they call the Tennessee Tuesdays, and they do virtual conferences on Tuesday with constituents. And you set up your appointments in advance. Email, quick. They get the information, and you know that their staff member or a member will carry this to them. Phone call. Those need to be quick and concise. When you're engaging face to face, always remember the rule of three, and we can thank Representative Lauren Underwood for this information. She is a nurse, and she's from Georgia. No more than 3 people to visit with a staff or legislator at once. Don't plan for more than 30 minutes. If you can make it less, that's even better. And don't ever try to discuss more than 3 items. 1 or 2 has always been my personal policy. Introduction. When you get there, each person needs to be introduced, the city and the state that you come from. A brief background of your nursing role. And then you want to focus on the bill, not on the weather, not on any hot topic outside of your purpose for being there. Okay, you want to do the email. Introduce yourself, your name, your city, state, and your nursing role. Always contact your legislator. Don't contact someone from another state or another district. Compose a letter for no more than what we would say 3/4 of a page. Put it together and then cut and paste and put it into your email. You can use sections of a policy brief, just the executive summary, your position, and a short story if you've got room for that. Use your personal email. It's important because be sure to let them know that you're a voter. No attachments because it will spam to a junk box. Okay, you're going to call. Usually when you call, they want to know, and this is usually done on the day that something is being voted on. You give your name, city and state, your role as the nurse, and short information on you support it or not. Many times they'll just say, yes, you support it, no, you don't. And share your information with us on the exchange. We are very proud of our members for getting involved. And the more that are involved, the more that'll be involved. If your friend that is a nurse practitioner can do this, so can I. So check your settings, so that you get daily updates. And if you want more detailed information, you can also enroll in the community health affairs. And here's some links for you.